Well, good afternoon, everybody, and a very warm welcome back to campus and the start of the academic year to you all. So you're coming back to campus, you're starting the academic year. Also, offices are opening, as you know, after almost 18 months working remote. And you'll find that staff in departments, offices, and services on campus are doing their very best to get up and running fully. But we know that there are likely to be some rusty spots which need attention as we start the year. We're all returning to campus, so students, staff, faculty, everybody's doing it together. Please bear with us as we address the rusty spots. I also want to acknowledge how difficult it is to come back to campus. We've all had a very difficult year, and coming back to campus can be very difficult as we come back to in-person learning, in-person research. In some of your cases, in-person teaching. And I very much want you all to try and remember to be kind to yourself. I know from my own experience, you can put a lot of pressure on yourself that you feel like you're taking a lot of time to do basic things, for example. So please be kind to yourself, and please be kind and patient with others. We're all really in it together. And GSAS, as you know, we have many resources that can help you if you're encountering difficulties. So please reach out to us if we can help. And you'll see in the chat a very useful link to some of the resources that might be helpful at this time. So throughout the fall term, please keep an eye on your inbox, because Harvard and GSAS will periodically send you important updates. So please do keep alert for those and open the communications. As we've all experienced, things change and policies can change with them. So please keep your eye on communications and kind of nudge people you know also to keep an eye on that as well. I also want to make sure everybody knows that GSAS maintains the coronavirus website. And that has a very helpful checklist for this coming fall, the fall of 2021. And you'll find links to important information and community expectations. It's very, very useful if you periodically check this, and you might want to put a bookmark in, because often I find myself often some of the questions that I'm having that come up from day to day, they are actually answered on that, and you can for shortcut to the information that you need. After this meeting, we know there's going to be a lot of information to take in, and GSAS will send a COVID news email, and that will outline what we've discussed here today, so that you'll have a handy reference point for all the information. And with that in mind, I'm going to hand things over to Jen Flynn, who many of you have met in these contexts as our excellent COVID coordinator for GSAS, in her wearing her other hat. She is the Senior Director for Global Outreach at GSAS. So Jen, you're kind of going to moderate the rest of the session, and I happily hand the baton over to you. Thank you.
Thank you so much, Emma, and thanks to everyone for joining today. Before we get started, I just wanted to jump in with a few logistics. So thank you so much to everyone who submitted questions in advance. We've asked our panelists to address those questions in the context of their remarks, but attendees may submit additional questions during the meeting through the Q&A function in the Zoom webinar. So we will not be using the chat. Use the Q&A function to submit your questions. And we have several GSAS staff members and guests who are participating in the webinar, and they will answer questions live as best they can. And we'll also be providing relevant links in the chat during the webinar so that you can save the chat at the end of this and go back to all of those links. Many of them will also be in the COVID email that Emma just mentioned. So let's turn to our first panelist. We are very grateful to have Maria Francisconi, the Senior Director of Nursing and Health Promotion from HUHS, here with us today. Maria, we know how incredibly busy you are these days, and we really appreciate you carving out some time to join us. So I will turn it over to you for some remarks before I jump in with some questions that have come in.
Terrific. Thanks, Jen. Thank you for having me today. I really appreciate it. I apologize in advance that I have to sneak out at 3:30, but hopefully it was very helpful to receive your questions in advance and have tried in my remarks to cover as much as I can, but again, also happy to take your questions through the Q&A. Just to give you a little of my background, I'm the Senior Director for Nursing and Health Promotion at HUHS. I'm a nurse practitioner by background. And over the last 18 months, have been working very closely with other leaders in the university to manage Harvard's COVID response. While I imagine that most of you are up to date on COVID-19 through other news outlets, I thought I would share with you just an overview of where we are today here at Harvard. As you may know, Massachusetts is seeing an uptick in positive COVID cases, and our cases here at Harvard reflect the same. In the last 7 days, we've had 39 positive cases. However, our overall positivity rate is 0.14%, which continues to be low based on the total population of people in our community, particularly given we have welcomed thousands of people in the last few weeks to campus. We also are lucky enough to have a high vaccination rate. 92% of our students are vaccinated, fully vaccinated, and 94% of our employees are fully vaccinated. And this information is always available to you on the coronavirus website that Dean Dench mentioned, if you are interested in knowing on a more regular basis where we are specific to Harvard. We know from our research and from our conversations with our experts on our medical advisory group that surveillance testing, masking, and vaccination are the best tools we have at this point in time to manage where we're at in the pandemic. We are seeing breakthrough cases in our vaccinated population. However, these individuals seem to be asymptomatic or with mild symptoms with no hospitalizations or death in these cases, which is consistent with what's happening across the state of Massachusetts. As with all things COVID related, studies on fully vaccinated individuals continue to be ongoing. We do know that it is rare for a fully vaccinated individual to pass on the infection to casual contacts if following all the recommendations from mask wearing and testing are followed. I think an important point that we've been really trying to stress to people is that no vaccine is 100% effective, and these vaccines were not designed to assure someone they would not get COVID, but rather to significantly decrease the risk of becoming ill and hospitalized with COVID. Which leads me to the important pieces of information we want to share, including be careful with unmasking. Think about limiting the number of people that you eat and drink with, and wear your mask properly over your nose and mouth with no gaps between the mask and your skin. As you may know, both the city of Cambridge and the city of Boston will be implementing masking indoors again, effective later this week. You can expect to hear more from the university toward the end of the week in anticipation of that mandate. So I saw a lot of questions about process for Harvard, and I thought that I would just spend some time covering what happens if. But let me start with testing. So at this point in time, you have all been enrolled in color.com, and all of you have an assigned testing cadence based upon individual vaccination status. I want to stress again that only those of us in HUHS know individuals' vaccination status, and we are actually the ones that assign your testing cadence from our system based on that. Frequent testing does allow us to identify infections early and isolate those individuals who test positive. You should be following your testing cadence carefully. The second is Crimson Clear. So this was a new web-based application that the university developed last summer in anticipation of a softer reopening of the campus. We use this if you are not feeling well and having symptoms that are suggestive of COVID. You can log into crimsonclear.harvard.edu and report your symptoms. You stay at home until HUHS reaches out to you. We have nurse practitioners who will call you and talk with you about the next best steps. Know that we work each day from 8 a.m. to 6 p.m. and will contact you sometime during that particular time of day. Depending on the volume of people, it may take us a few hours to be in touch with you. And in the meantime, please don't go to class. We usually suggest you would take an additional color test and await the results before clearing you to go to class. Contact tracing. So upon the start of this pandemic, the state of Massachusetts was responsible for all of the contact tracing in the state. And then as we came into last summer, the universities locally were deputized if they were able to set up a contact tracing team. And Harvard was lucky enough to be able to do that. So we have in fact been deputized by the State Department of Public Health to perform contact tracing. We follow exactly the rules and the regulations of the state and local departments of public health when determining isolation and quarantine. As you may know, DPH takes their guidelines and regulations from CDC and local public health experts, which in turn becomes our guiding protocols at Harvard. Our contact tracing team is comprised of a team of registered nurses, all specifically trained to perform contact tracing, working 7 days a week from 8 a.m. to 12 midnight. So if you test positive, a member of our contact tracing team will be in touch with you by phone. This means please answer your phone, even if you don't recognize the number, especially if it is a 617 number. Our phone lines do not say HUHS when we call. Please make sure that your voice mailbox can take messages. We'll work with you to determine your housing situation, your close contacts, and again, that definition is those who've been less than 6 feet for more than 15 minutes over 24 hours, and assist you to get care if you are experiencing symptoms. Generally at the graduate school level, students have their own bedrooms, which allows them to isolate from others in that bedroom. When coming out of the bedroom to use the bathroom, someone who is positive should be masked at all times, and no one else should be in the bathroom at the same time. We generally recommend people wipe down surfaces they have used in the bathroom, though the learning to date, and this is important, is that there are no reported transmissions of COVID from surfaces. You can safely be in an apartment with an individual who is tested positive without having to leave the space, as long as the person who is positive remains isolated in their own bedroom. Isolation usually lasts 10 days, and we tell individuals to be sure to be in touch with their professors about their need to be out of class. I think Jennifer and others can talk more about the support for students who test positive, but we do recommend making sure that professors are aware that you will not be attending class for that period. We do not notify all members of a class if the person is positive. We work closely with individuals to identify those in class who were closest to them within that 6 feet distance, but the entire class is not considered at risk, especially with consistent indoor masking. The next category is if you are a close contact. If you've been less than 6 feet for more than 15 minutes over 24 hours from a positive individual, you are considered a close contact. If you are fully vaccinated more than 2 weeks from your last dose of a series or a dose of the Johnson & Johnson vaccine, you do not have to quarantine. The current research and recommendations from the CDC support the low risk to others a fully vaccinated individual brings if they are masking appropriately and testing regularly. We have seen little transmission between vaccinated individuals and vaccinated individuals. If you are not vaccinated and a close contact, you will need to quarantine for a minimum of 10 days or more if you are symptomatic at all during those 10 days. Through our contact tracing team, we will work with you to monitor you, confirm the testing schedule, and be available to you if you have questions. I've just hit you with a lot of information, and I'm happy to stop in just a minute, but just wanted to say boosters of vaccine for those who are immunocompromised are now recommended. If you are one of those individuals and HUHS is aware of this, you will be receiving a message from us this week about how to proceed in getting a booster. And I'm sure that many of you have seen that the government has come out with the expectation that at some point soon, there will be making a recommendation for all of us to have a booster. There's still some conflicting research questions about that, We aren't 100% sure if that recommendation will continue to come through in September, but if it does, we are actively prepping to have major COVID vaccine clinics together along the same time we would be doing our annual flu vaccination efforts. And now more than ever, I would encourage all of you to get the flu vaccine as well. I'll stop there and see if there are other questions. I've just given quite a bit of information.
Thank you so much, Maria. And we definitely have some questions coming in for you. So
Sure.
One is, how will Harvard be able to tell who was within 6 feet of whom in a classroom? Will you reach out to professors for a seating chart, or kind of how will you get that, gather that information?
Yeah, that's a very good question. We've done a couple of things. So we have worked with the individual person who is positive. In some cases, that person is aware of who is around them within that 6 feet distance. In most cases, we have reached out to resources at the school, professors, emergency management folks, to try to get a list of those who are in the class. And oftentimes that helps for the positive case to be able to identify the people who may have been closest. We may also be able to identify those who had been in the general area. I won't say it's necessarily easy, but to date, we have been able to be successful in understanding who has been around the particular individual who has tested positive.
And just along those same lines, will HUHS reach out to the professor or TF instructor to let them know that there was a positive case in their classroom?
No, we generally do not reach out directly to the professor or TA to let them know that there was a positive case. We try to keep information as private as possible within HUHS. We generally will let the person who has tested positive know that they should be in touch with their professor to let them know that they will be out of the classroom, and allow it to be a conversation between the person who is positive and the professor or TA, who can choose to share that information or not share that information. Generally, the highest risk, if you will, is the people who are within that 6 feet distance. And it's usually unnecessary for us to share more broadly with the class that there has been someone who's tested positive.
Great. Thank you so much. Now, I want to go back to a point that you made a little bit earlier about being able to safely isolate, with someone else. We do have a question here where someone's roommate did test positive and they were in a shared space. We, because of the very limited isolation housing we have, we will be able to isolate on campus students who are living in the GSAS residence halls. But for all students who live off campus, which is the majority of our students, they will isolate in place. So could you just reiterate again kind of the health and safety guidance around isolating safely if you test positive or someone that you live with does?
So the highest risk spaces where you are potentially exposing others is, of course, when you remove your mask, and you have to do that in order to eat and in order to sleep. You don't want to sleep with your mask on. And so where we really want people to isolate is within a bedroom space. And so going out into a common area, walking through a common area, going to the bathroom, as long as the person who tests positive is masked during that activity, there is little risk to the others who are living in that common space. And I would say, at this point in time, we've been doing this for more than 18 months and have had many cases of individuals who are living with other individuals. And we haven't seen the transmission in the case in which a person who is isolated in a bedroom space separate from others transmit that to others in their apartment or common living areas. It's really most important that the sleeping space is a space that is private and a place in which that person can take meals and be unmasked. And that is really the goal of it.
Thank you. Again, back to a point you made earlier about in the classroom. A question is, would you recommend that TFs and faculty create a seating chart for their classes that they're teaching? Would that aid in your contact tracing efforts?
Absolutely, if that is a possibility for people. You know, we have had many faculty and TAs say that things often move around in their classrooms. However, even having a sense of where students are in the classroom, if that's an easy thing for any of you, that would be fantastic for us. It's very helpful to us. It's certainly not a requirement, but it does assist us in the process of being able to understand further what's happening in the classroom.
A question about masking has come in. So in the environmental health and safety kind of guidance on mask wearing and face coverings, it kind of discourages people from wearing N95 masks. Can you talk a little bit about that and other instructions for making sure that people are wearing masks properly to protect themselves and others?
Sure. Most of the research around N95s is that it is not required in the setting of more public spaces. The N95s are really designed to help protect people who are in constant, regular, close contact with an unmasked individual who is COVID positive. So that is a space such as a hospital setting where we are taking care of people who are obviously ill with COVID and unable to be masked. In the general public, the surgical mask, the blue mask that you see throughout all of Harvard, I don't think I have one. Yeah, that's it, Jen. That one is actually plenty sufficient to help protect people in the indoor setting that all of us find ourselves in. We've been using them, all of us at HUHS, to give you a sense of this. All of us at HUHS wear those on a daily basis. Our N95s are used only for our clinicians who are going in to see symptomatic people. Some of that is, and EHS is probably a better resource for all of the science around this, and I would refer to them around a lot of the details, but would say that, N95s at many points in our pandemic were in short supply, and I think unnecessary for all of us in the general public to have a need for them. I think the most important thing about mask wearing is to make sure that it fits snugly around your face and that there are very few gaps. Those surgical masks actually have a nice nose, a piece of metal that allows you to kind of mold the mask a little bit more to your face, which is very helpful. If you find that where it comes around your ear, it's loosening over the day, you can just take it off and knot it, which helps to keep it tight. You also can expect to see, we're putting out a communication from our executive director later this week. And within that communication, we are planning to embed what we think is a pretty good video, a YouTube video around how to appropriately wear and keep a mask on throughout a day. So look for more information in our communications later this week for more details and specific pictures, if that's helpful to all of you.
Okay. Great. I know we need to let you jump off for your next meeting. I'm just going to close. We've had a couple of questions come in that are specific to people who are immunocompromised.
Yep.
And I'm just wondering if you can speak a little bit about, there are two questions that are pretty far apart in the chat. Okay. So, for people who are immunocompromised and are maybe at a higher risk through breakthrough infections, because many breakthrough infections are asymptomatic. Is there any guidance you would like to give to immunocompromised students about additional protections that they would want to put in place for themselves, or protections that Harvard has in place to protect their health?
Yeah, I think that it's a great question, and I appreciate that. I think certainly I would stress and emphasize for those who are immunocompromised, and I'm sure that most of you out there who fit this category are already doing this, but that is really limiting the activities in which you are unmasking, making sure that you know the people and their status as you are doing that, unmasking. I think that Harvard has really, we have a robust, Zoom. We have a robust testing program, which really does help to identify these infections as early as possible. We are, unique compared to the general community who doesn't have as much access to testing. And I think within this community, you can be assured that we are finding these asymptomatic infections as quickly as possible. But I think that really working to mask and being careful with who you unmask with is, and getting boosters and making sure that you're getting that booster for COVID vaccine is the most important thing you can do.
Maria, thank you so much for giving so much of your time at such a busy time of year. We are enormously grateful. I know we've got lots of other questions that came in the chat.
Sure.
We will follow up with you
absolutely
after this.
Happy to answer those by email, and I'm always available.
Thank you so much. Really grateful to you. Thanks.
Thanks for having me. Appreciate your time. Take care.
Thank you. I know we have a lot of questions in the chat that relate to the academic experience in the classroom. So I'm going to turn it over to my colleagues, Sheila Thomas, who is the GSAS Dean of Academic Programs, and Noelle Bisson, who is the Associate Dean, to answer some overarching questions about what happens in the classroom for students who are learning and who are teaching. So Noelle and Sheila, over to you, some opening remarks, and I'll come back with some specific questions for you.
Sure. So I think as our previous guest, HOHS's Maria Francisconi very nicely provided some of the key background, and critically that, the university's decisions around safely returning to campus, including the principles that have been established for the classroom, are based on the advice of our medical experts who have been looking at guidelines from the CDC, from the state departments of public health, from the city's departments of public health, and that's been the basis for establishing the guidelines of the classroom as well. Noelle, why don't I turn it over to you?
Thank you, Sheila, and hello, everyone. I am going to try to answer a few questions that came in that are specific to the academic experience and how a student might navigate it after, after testing positive. And I'll start with two questions that actually are I will answer in the same way. One is, how will vaccinated students who test positive breakthrough cases be addressed in regards to class attendance? And then a similar question, if I test positive for COVID, how will I be able to keep up with my classes? Anyone who tests positive will need to follow UHS guidance and instructions on isolation, as we just heard from Maria Francisconi. And as Maria said, students will be encouraged to reach out right away to their instructors and to start the process of figuring out an academic plan to give them a way to keep up with their classes while they're in isolation. If a student feels well enough to keep going with classes, we have a number of solutions that we have provided with our faculty with to think about how to accommodate a student in this situation. Everything from, the very simple, from getting notes from a classmate, viewing lectures later if the instructor can do local recording and upload, participating in a limited capacity via Zoom, if the course can be set up to do that. And also, of course, connecting directly with the instructors in the course. And I should add that we have, that instructors and TFs have been given similar guidance for themselves, should they become ill or should they test positive and need to isolate. So we have a number of ways in which a class can be temporarily accommodated for that person or those people. So another question that has come in, if someone needs to quarantine after testing positive, will faculty adapt courses to be hybrid for those students? Our teaching mode this fall is an in-person one, and most courses aren't going to be able to provide synchronous online options for a student in quarantine. Although some classes may be able to make use of, as I was saying, different technologies, including this OWL technology that some classrooms have, and also Zoom. But depending on the course, the student might also get notes from the classmate, as I said before, or from the TF, or it might be appropriate to connect directly with the instructor. As in the previous answer, the solution is really going to be local to the course and depend on the situation with the student and the type and size of course. Next question is, if someone tests positive after attending class and the whole class needs to quarantine after contact exposure, will the class be virtual during that quarantine time? So I think actually Maria Francesconi's responses really helped to address some of the specifics in this question. And I think it's from based on what she's saying and what we know from the CDC and from UHS, it's unlikely that the whole class would need to quarantine as long as everyone is adhering to mask mandates. But decisions about how to accommodate a quarantined student or students will need to be worked out by the instructional staff and with the student, and would really depend, again, on the number of students in the course, the type of course, the pedagogy involved, et cetera. What happens if someone shows up to class with COVID symptoms? Can the professor tell them to leave? So first of all, if you are having COVID symptoms, you have been asked to report these in Crimson Clear, just as we heard Maria describe. And then I guess the other thing we would say in response to this particular question is, while someone is coughing or sneezing, might make one feel uncomfortable in the class, you can't assume necessarily that this is because of COVID-19. What happens if someone wears a mask under their nose in class? So I think this is raises a larger question of what to do if you notice that someone is being non-compliant with the mask mandate. If you're concerned about a situation, you should be empowered to speak up. And if you feel uncomfortable speaking to the person directly, you can always share your concern with the instructional staff. Instructional staff have been given guidance on how to handle a situation of someone not adhering to health and safety protocols. We are all expected to wear masks and to wear them appropriately. But the last thing I'll say to this question is bear in mind that some individuals may receive an accommodation based on their situation, and that information is private. Can Harvard release policies to reassure students that their academic success in classes will not be impacted by testing positive or being exposed to COVID? So in answer to that, the university's approach to the pandemic has been to help keep infection from spreading on campus. And as would always be the case, if a student were to fall ill or become injured, university officials will help as appropriate to assess the situation and to work with the student and the instructor to figure out a way to support the continuity of the student's work in the class, depending on how sick the student feels. Will Harvard provide wipes to clean desks and tables between classes? I think that there's a lot of information about kind of cleaning, and also I would point to what Maria Francesconi just told us about tactile transmission or the lack thereof. But cleaning supplies are available in every classroom if students wish to use them. And the very last question I have on my list is, why is the FAS line on holding class outside more about maintaining Harvard's communication strategy than allowing faculty and TFs to do what's best for their own sense of safety? So the steps that Harvard has taken throughout the pandemic have helped to keep infections from spreading on campus, and the university continues to monitor the public health situation and will continue to update our protocols with the health and safety of the community being the top priority. And then the last thing I think I would say in response to that question is also that our policies are developed bearing in mind that we have a vast number of courses that we are supporting and needs that cannot be replicated in an outside environment, such as the various technological supports, et cetera. With that, I think I'll turn things back to Sheila and also to Jen in case there are other questions that have come up.
I think we will deal with questions from the chat at the end, just so we can get through a few more items that came in advance. Sheila, unless there's something, kind of a closing statement that you would want to say. On the same lines about kind of academics and accommodations, I'm going to turn it over to our colleague in AEO, Assistant Director of the Accessibility Education Office, JC Miller. JC, thank you so much for joining us today.
Hi there, Jen. It's my pleasure. I think I'll start out first by answering a few questions that were submitted ahead of time. These questions pertain largely to masks and the intersection of, the masking policy and disability accommodations. And then I'll also make a little bit of time to review the general process for connecting with AEO if you would like to seek out disability accommodations. So the first question that came about was, do we know if faculty and/or staff will be told if a student in their class, lab, department, etc., has a mask exemption to prevent them from having to explain themselves over and over? The answer to this question is that if a student is eligible for an exemption from the mask policy, that they will have already been connected with my office, with AEO, and gone through the process of determining the accommodation to be exempt from the mask mandate, and therefore they would already have this accommodation eligibility as part of their profile that's maintained privately here at AEO. Students notify their instructors of their eligibility for accommodations through a process that is automated through our information management system. So any student who is eligible for this accommodation can online request that their instructors are notified that they are eligible for this accommodation. If students need any additional support regarding communication surrounding their accommodation eligibility, we at AEO, of course, are always happy to help facilitate that communication and answer any questions that might come up. A second question related to masks. If I need clear masks to read lips of my instructor or my students, how can I request those? This is a really great question. So if you need access to clear masks as an accommodation, please connect directly with AEO. We have a supply of masks at the ready to distribute directly to students. And by connecting with AEO, we'll also be able to notify your instructors that they're expected to wear these masks to facilitate access. It's pretty much the case that AEO is already aware of most deaf and hard of hearing students who might require clear masks as an accommodation. So we've already equipped them with the actual supply of clear masks, but please connect with us directly if you find that you might need clear masks in order to facilitate access for someone with a disability. I think we probably have some audience questions, but before segueing to those or handing it off to other panelists, I just wanted to give a quick overview of how to connect with AEO in case you have a new accommodation request or you have other questions about accommodations. So AEO has a really simple 3-step process to get registered with our office. On our website, you can click in the top right corner, the link that says register. There you'll be taken to a form that you fill out online where you tell us a little bit about your experience with your disability, what barriers you face in the environment, and any accommodations that you might expect needing to access the educational experience. You'll then be prompted to upload supporting documentation. We don't want documentation to be a barrier to getting initially connected. So in case you don't have documentation at the ready immediately, just shoot us an email or give us a call, and we'll be happy to talk through with you how to get connected with a member of our staff to discuss your request. Please know, though, that documentation is requested universally of all applicants for accommodation. So it might be that we request down the road that we do have support to verify your disability, supporting documentation, excuse me, to verify your disability status. The last step in the accommodations process is to meet with a member of our staff. For PhD students, master students affiliated with GSAS, usually it's me. So the last step is to meet with me, talk through your disability, and together we formulate a plan of accommodations to support your access. I always like to advertise myself as a resource. I know we've got the AEO website in the chat, but please feel free to reach out to me directly if you just need a face, maybe to connect a peer with, or if you have questions yourself, I'm more than happy to help out. I think I'll turn it back to Jen.
Thank you so much, JC. And thank you again to Sheila, Noel, and to you for helping us understand how we can best support students in the classroom for their learning and teaching needs. I would now like to say a few things related to campus protocols, related to some questions that came in advance. So masking. So Cambridge issued a new mask mandate, which goes into effect on September 3rd, and Boston has a mask mandate in place that went into effect on August 27th. So all students, faculty, and staff must wear masks inside Harvard buildings, and unvaccinated people who are unvaccinated must wear masks on campus, even outside. So the exception is when you are actively eating, but you should return your mask as soon as that eating is over and not continue to unmask while you socialize, with friends after eating. And just a reminder that unvaccinated students, faculty, and staff must maintain distance when they're eating, even outside. Someone asked a question about where can I unmask and eat safely? So Smith Campus Center, the GSAS Student Center, and other designated spaces around campus in Cambridge, as well as designated spaces in Alston and Longwood, are where you can remove your mask and eat lunch. We had a question asked about, well, what about kind of drinking if I'm just going to have a sip of my drink? So the policy is, your mask, you unmask, you take a sip of your drink, you return your mask. You don't take your mask off for the duration it's going to take you to drink your cup of tea or coffee. So, face coverings can be removed when attendees are actively eating. But again, you want to follow the guidance for on-campus activity, and I think that's going to go in the chat. So you, especially unvaccinated persons, should continue to practice physical distancing while they're unmasked, and that policy describes how you can do that safely. In terms of a testing cadence, hopefully all of you have started your testing, but if you are just returning to campus now, the arrival protocol for all students is to test on the first day on campus, on day 4 or 5, or on day 7. And after that, you need to test once each week if you're vaccinated and 2 times a week if you're unvaccinated. Someone asked if the testing cadence for 1 week includes weekend days, and the answer is yes. So everyone is on a 7-day or cycle if they are vaccinated, and they're on a 4-day cycle if they're unvaccinated, meaning that you will show up as non-compliant after 7 days or after 4 days. We had a question about if I'm at the Broad. So anyone who's on campus at Harvard has to test via Harvard. We're not able to accept external results, though Broad may be willing to take our health results in lieu of testing there, so you should check in with them. If the Broad is also using color, you would need to create a separate color account for your Harvard testing, and then you just need to remember to log in to the appropriate account each time you take a test. If you're full-time at the Broad and you don't come to campus at all, then there is a form that we'll be putting in the chat that you can complete. And then in that case, we will suspend your testing cadence for Harvard for the duration that you'll be away from campus. But again, if you're coming even once to campus, we will put you in an infrequent testing cadence. So that form will help direct us as to what your testing cadence should be. I've had a lot of questions over the last week about where do I pick up test kits. So just a reminder to everyone that if you are in an FAS program, your locations where you can pick up test kits are in the Science Center, which is located at 1 Oxford Street. and you pick them up near the security desk. Northwest Labs, which is located at 52 Oxford Street. The Knoffel building at CGIS North, that's at 1737 Cambridge Street, and the Barker Center, which is 12 Quincy Street. Students in our interfaculty programs can pick up test kits locally. We worked with all of our interfaculty partners to make that possible, but you should bring your HUID because you may be asked to show that. We have given them the numbers of students in our interfaculty programs, so they have built those into their test kit ordering, which is why, you know, if I'm on an FAS program, I can't go to HMS to pick up a test kit. I'm not going to be on the list. We've gotten a lot of questions about kind of color accounts. Some people are getting a message from color saying my email is not eligible for testing, and what do I do? The first thing to do is to go into Crimson Clear, which is crimsonclear.harvard.edu, and scroll down to testing to find your provisioning email. This is the email address that you should use to set up your color account. Some people, it's their g.harvard, and some people it's their, you know, it's another email address. So please just look at your provisioning email and log in with that account. You can also try resetting your password. That actually did the trick for me when I had problems setting up my own account. But if you try both of those and you still can't get in, please email GSAS testing compliance at fas.harvard.edu. We'll put that email address in the chat, and send your name and your HUID. And then I can make sure that you set up correctly in the eligibility file, or I can escalate it to HUIT depending on the kind of what's going on. We've also had some questions that when I log in to my color account, it says awaiting sample. And does that mean my test kit wasn't picked up and I need to retest? So test kits are picked up at different times across campus. We've got 22,000 students on campus and lots of different spaces, and faculty and staff on top of that. So there are different pickup times depending on location. The earliest is at 2 p.m. Monday through Friday, and the latest is at 5:30 p.m. On weekends, it's generally 10 a.m. Is the first pickup time. So if you submitted after the pickup time, your sample will be collected the next day, and then your results will be returned in approximately 24 hours. But there is lots of volume right now, as you can imagine, particularly because everyone just getting back to campus is in a 3-time-a-week testing cadence for their first week. So it may take a little longer in that first week. What that means, a waiting sample, is you've activated your test kit, but they haven't analyzed the results yet, and color hasn't received that information. That's what that means. But know that it's coming, and if it's been 48 hours and you still haven't heard, please retest. Then it means it's, you know, kind of something went wrong in misplacing your, maybe you left it by the bin, you didn't drop it in the bin, but please just test again if you haven't had your results within 48 hours of submitting your test kit. Compliance, this is the last thing I'll talk about. So Color will send you automatic messages if you miss your test. And if you get those messages, please test immediately. GSAS is also monitoring student compliance with the testing requirement, and it's just essential that everybody in the Harvard community agrees to this shared obligation and commitment to act safely in accordance with our public health directives. So just hope we can count on all of you for your adherence to these safety protocols. And if you don't, you'll get a message from GSAS reminding you to test in addition to what you have received from Color. And subsequent instances of noncompliance will be addressed more seriously. First, we'll notify your graduate program, and then continued noncompliance may result in additional consequences, including referral to the ad board or restriction of campus spaces and resources. So please do your testing and we'll all be fine. So we've also created a form, as I mentioned earlier, that you can complete if you are going to be away, either short-term because you're going to be on vacation for 2 weeks and you're going to miss your testing cadence. You can let us know and then we won't send you a compliance message, or if you're going to be away long-term because you're doing field research or you're on a dissertation completion fellowship, then we will alter your testing cadence if you're going to be away long-term. I will stop there and I'm going to turn things over to my colleague, Betsy Scola, and financial aid at GSAS to talk about taxes and stipends. And then we'll get to more of your questions at the end. We have Betsy and then our other colleague, Jackie Yoon, and then we'll turn to everyone's questions in all the different areas. So Betsy, over to you.
Thank you, Jen. Again, I'm Betsy Scola. I'm the Associate Director of Financial Aid. Totally switching gears right now, but I hope that you are all getting settled on campus and in your residence. I had the opportunity to drive through Alston yesterday, and I just saw a sea of U-Haul trucks and tons of furniture and whatnot on the sidewalks. I have to help my son move tomorrow, so I can totally sympathize with all of you. I promise I'm going to be very brief. I just wanted to give you some general information about stipends. We've had a lot of questions about stipends, and they are paid on the first of the month, unless the first of the month falls on a weekend or a holiday. And then it's paid on the first business day prior to that. And Danielle has popped into the chat a link to information about your stipends. Stipends are also considered taxable income. This is very important, and this is a question that we get a lot. So that being said, we are planning 2 tax workshops the end of September for G1s and G2s. There's going to be one for US citizens and permanent residents and one for international students. We'll be sending out more information on that as soon as the dates are confirmed. In the meantime, if you have questions about taxes, you can visit our wellness webpage, which Danielle will also be popping into the chat, and you can view our spring tax workshops that we just had back prior spring, and they were recorded. So you can watch those tax workshops. We will also be having future spring tax workshops as we get closer to the tax filing season. If you have any specific questions related to your own personal circumstances, you can contact your financial aid officer, otherwise known as your FAO. And Danielle has also popped a link in the chat as to how you, if you don't know who your FAO is, how you can figure out who that person is. So thank you very much for having me today, and good luck with first day of classes on Wednesday.
Betsy, thank you so much. Now we'll turn things over quickly to Jackie Yoon, who's our Executive Director of the GSAS Student Center. And then we'll answer 1 or 2 last questions live, and then we'll follow up with answers to the remaining questions. Jackie, over to you.
Thank you so much, Jen. I'll be really quick because I know that a lot of you have questions. We did receive a question about how student clubs should be planning a return to in-person events this fall. So here at the GSAS Student Center, we've been recommending that student leaders hold events virtually in September. That gives students a chance to get to campus, get comfortable, quarantine if necessary, jump on the test cadence, and get vaccinated if necessary. If groups want to hold in-person meetings in September, we're advising them to make sure they're following both the Cambridge and Harvard University's policies when holding events and programs. And we've been directing folks to the Harvard University Guidance for On-Campus Activity, which is put out by Environmental Health and Safety. And I think we're going to drop that in the chat for you. The GSAS Student Center at Lehman Hall will be opening up for student group reservations starting October 1st. And we will be launching our first in-person program with the GSAS Lunch on the Lawn on October 2nd. And I think someone's going to drop a link to that event as well. If anyone has any questions or want to talk through event safety, they can reach out to the center team directly anytime. Thank you, folks.
Thank you so much, Jackie, and thank you to everybody who joined. I know we only have a couple of minutes left, and some of you might have to drop off. So I will just maybe ask 1 or 2 questions from that were submitted through the Q&A. So let's see. So here's a question. In the unlikely case that a professor is not working well with a student who's had to isolate due to being infected with COVID, who should the student reach out to? I'm going to look to Noelle or Danielle to answer this question.
I can chime in, and Noelle, please feel free to as well. These are challenging conversations sometimes. And so hopefully you'll be working with your faculty member directly, with the TF directly. Each course is a little bit different. And if you're finding that it's a little maybe challenging, they're hard to work with in some way, please work with your department administrator if they can be a good partner for you. And if you're not sure how to handle that, you can always meet with student services and meet with me. I'll drop my link in the chat as well. And we can talk through kind of how to navigate some of those conversations and asks and make sure that you get the support you need with the resources that we have.
Thank you so much, Danielle. JC, here's a question for you. If a student has a mask exemption accommodation, what additional provisions has Harvard put in place to safeguard others who are compelled to share an indoor space with them, especially TFs and faculty?
Actually, I was just formulating an answer to type, so it's great that you asked. Each request is taken into consideration individually, and so it's hard for me to give a blanket answer about the exact special provisions that might be put into place for the health and safety of other people in the Harvard community whenever someone is granted an exception, simply because we would consider the spaces that the student with the exception might occupy and then work with any other occupants of those spaces to figure out how to ensure safety. A few examples might include accounting for extra social distancing, opportunities for remote participation, other things that we can consider, but it's hard to say exactly what they might be because they are managed individually on a case-by-case basis.
Thank you so much, JC. Appreciate that. Okay, we have some questions about kind of testing. If you're not going to be on campus regularly, I would just ask you to complete the form that we put into the chat. It will also be in the kind of coronavirus email that goes out. It's also on our coronavirus webpage. Please fill out that form. It has a bunch of information that we'll need to go in and see if your on-campus presence warrants a change in your testing cadence. So I would just advise you to go and look at that. And that's the same if you are working in another part of the university, you're not going to be on campus, but you're working at Mass Eye and Ear, you're working at the Broad, you're working in the hospitals, and they might have a higher testing cadence. You would want to follow that. But please just fill out that brief survey. It's only a few questions, and then that gives us the information that we need to go in and revise testing. So I know we've come to the end of the hour and we haven't gotten to answer all of your questions, but we want to say thank you to all of you for joining us today. We will be reviewing all the questions that came in and following up on our coronavirus email and on our coronavirus page to the answers to the questions that we didn't get to today. But thank you all so much for joining with us and keeping Harvard healthy and keeping each other healthy and safe. And we look forward to a really wonderful semester. So thank you all so much for joining us today.